longevity defense. 6:15 right now. Usually, insurance companies don't cover colonoscopies until patients are 50 years old. But in recent years, doctors say they've seen more diagnoses of colon cancer in younger patients. Pain and unexplained bleeding sent one 42-year-old mother in Harford County to the doctor. She got a diagnosis she never expected. WMAR 2 News' Kelly Swoope has her story this morning.
It was really like being punched in the stomach, like the wind was taken out of your sails.
That's how Jess Schamberg felt when she learned her intestinal pain and bleeding was something a lot more serious.
I had a colonoscopy in late June and literally came out of the anesthesia and was told that I had a cancerous tumor and that I was going to need most likely radiation and chemotherapy as well as surgery.
Cancer? She didn't have time for that. With 4 young children, a husband, and working full-time, this mom had so much life to live at just 42 years old.
Honestly, there was a why me in the very beginning, and then there was a moment of embarrassment. That probably sounds strange, but just you know, really not wanting to tell anybody because of what I was going to have to go through.
Jess was an unusual case for colon and rectal cancer because of her age, but she was initially referred to me because of pain that she was having down in her pelvis, and didn't sound like it was something that was benign.
Dr. David Lisle, her colorectal surgeon, had Jess in front of an oncologist within 48 hours of his diagnosis. Her treatment included radiation, chemotherapy, surgery, and more chemotherapy.
Care of cancer really takes a multidisciplinary approach between the oncologists, the radiation oncologists, the GI doctors, the surgeons, all working together to coordinate their care and get them to the most appropriate treatment.
Dr. Lisle says their team approach to treatment at MedStar Franklin Square Hospital can be a lifesaver.
Having constant communication with all the specialists who work closely together or in one place and can speak with each other frequently to adjust the care to each patient is, I think, vital to rectal cancer.
Now nearing the end of her journey, Jess has a new lease on life and a new mission.
I feel like I've kind of entered that warrior stage where I'm you know, kind of past the why me. And now it's, you know, I'm going to beat this. I have to beat this.
Jess just finished up her 8th and final round of chemotherapy. Next month, on April 5th, she'll have her scanned and hope to find out she's cancer-free.
That was Kelly Swoope reporting a colonoscopy can save your life. And again, there's more and more research showing that recommendation of waiting until you're 50 to get one may be too late. Join WMAR 2 News and MedStar, the Health Cancer Network, as experts answer your questions. Watch WMAR 2 today at 4:30 and throughout the 5 and the 6 o'clock newscast. If you have any questions about colonoscopies, you can get free answers later today. 6:18.